This is Justin Chamberlain's assessment of the newborn, NUR 3069. So before I enter the room, I'm going to do a chart review of my patient. This patient is just a few hours old. I was not in the room for the initial delivery. However, I'm going to perform the initial assessment on the baby. So the baby is just a few hours old at this time. Prior to entering the room, I'm going to wash my hands. I'm going to make sure all my equipment is cleaned prior to coming into the room. And I have a blanket, so I'm going to ensure that my baby is warm throughout this procedure. I'm exercising proper body mechanics by keeping the baby at a safe yet comfortable working height. Initially, I'm going to start by getting some objective data from the mother. Things I would want to know is, did she have any pregnancy-induced hypertension, gestational diabetes, anything that would affect the development if she was taking multivitamins, anything that I could think that would affect the developing baby, and to see if any medical problems that I can potentially come across with this baby. Important things to ask would be, well, this baby is just a couple hours old, but I want to know, does mother have any plans of breastfeeding the baby, or is she just going to use formula? Obviously, breastfeeding would be the best option. And I would want to know if this baby was born full term or was born premature. And I can ask the mother, or I can do a chart review and to see how many weeks old, or how many weeks pregnant, how far along she was before she gave birth. And important things to know, was it a natural birth or a C-section? All right. So I did a chart review on this baby, and I found that he was born with blue hands and blue feet. Therefore, his initial APGAR score, he was given a 9, and then his 5-minute APGAR score, his initial APGAR score was a 9. His 1-minute APGAR score, he was a 10. So soon after birth, his hands pinkened up, and he was given the highest APGAR score you can get, which was a 10. And with my initial assessment, I want to get a set of vital signs on the baby. So I obtained some vital signs on this baby, and the baby's temp was 98.9 rectally. He has respirations of 44. His heart rate is currently 154, and he is satting 90. I'm going to turn my attention here to the baby. Okay. And he is currently satting 98%. And I did obtain a blood pressure, although it wasn't necessary. The book says, generally, and very early, the blood pressure is not warranted. However, I did obtain one. It was 65/30. So all his vital signs look great. The next procedure I'm going to do, this is my tape measure. I'm going to measure this baby. And I'm going to get a head circumference, I'm going to get a chest circumference, and I'm going to get a length. I'm going to do that, measure the baby's head. Great, I have 34 centimeters on the head. I'm going to measure the chest. Great, I have 32 centimeters on the chest. The baby is 21 inches long, and I'm going to get a weight on this baby. Great, 7 pounds, 8 ounces. Healthy looking baby boy. Now, I'm going to check his mental status. I'm going to look to see if I see anything abnormal that I may think is going on with him. Is he easily consolable? Is he crying and not consolable? And he's calm and he's not irritable. Therefore, his mental status thus far looks great. Next, I'm going to move on to the skin, the hair, and the nails. He hasn't received his first bath, so I can see vernix caseus on him. which would be, I'm considering that to be another normal finding. I don't see any birthmarks, no bruising, no abnormal skin pigmentation such as a port wine stain, anything like that. He appears pink, and he has an abundance, much like my son. He was born with an abundance of shiny hair, which is great. The nails appear soft, they're growing outward, and they appear normal length, hiated. He has some milia on his nose, and this is another normal finding. So I'm going to move on to the head and the neck. Okay, I'm going to palpate the anterior and the posterior fontanelles to ensure that they're not bulging or significantly depressed, and his fontanelles feel great. I'm checking his face at the same time. Can you turn that light on, please? His face has great symmetry. So I'm going to check for head lag. I'm going to lift his head up. He does have a little bit of head lag, which is normal in a newborn baby. And so I'm inspecting and palpating the trachea. His trachea feels great. I'm going to now auscultate for any bruise I may hear in his neck. Okay, so I hear no bruise in his neck. Next, I'm going to move on to the clavicles. I'm palpating the clavicles. Okay, I feel a little bit of deformity here on the left clavicle, and some crepitus. And that makes him cry. All right, so it's obvious he probably had a clavicle fracture being born. So that would be my first abnormal finding. Would be this possible clavicle fracture that I've noticed. So I'm checking his eyes. Oh, I need to get my pen light. Oh, I had it here somewhere. Where's my pen light? Oh, here we go. So I'm checking his eyes, and I'm going to shine this light approximately 24 inches. And the battery's dead. Okay. I'm going to shine this light approximately 24 inches from his eyes. I'm going to check. I see a red reflex, which is good. That's a normal finding. I can attempt to see if he'll follow objects. He may be a little too young, just being a couple hours old. He may not follow objects. So I don't see, he's not going to follow any objects for me. He's just a little guy. All right. And I'm moving on down toward the ears. I see they're symmetrical. The pinna is not above the inner canthus of the eye, which is great. And so here I have my otoscope. Yeah, I know it looks a lot like a spoon, but it's an otoscope. And I'm going to visualize, that's tympanic membrane looks great. And this tympanic membrane looks great. So his tympanic membranes are intact and they look great. And next, I'm going to observe the nose and the mouth. The book suggests taking maybe possibly a small mirror to see if you can see the inside of the nose. And I can see the inside. It looks great. So he's still crying from when I pressed on his clavicle. So this is going to warrant me the opportunity to inspect his uvula and the inside of his mouth. Everything inside of his mouth looks great with my tongue depressing. I see equal chest rise, great chest rise. His respirations are even. They are not labored. He's not using any accessory muscles to breathe. So now I'm going to auscultate my lung sounds. I notice his respiratory rate is 44. So I'm doing the front, and then I'm going to gently roll him over, or I can cradle him. And I'm going to check these posterior lung sounds. Great. And throughout the process, I noticed as stated earlier, his no beds were pink, so I know he's oxygenating well. And with the clear lung sounds, it all fits together that his respiratory status is normal. And here I'm going to auscultate his heart rhythm. Sounds normal. And at the same time, I'm checking his brachial pulse and his femoral pulse. And those pulses match the heart rate. Moving down, I'm assessing his nipples. His nipples appear intact. I'm inspecting the abdomen. I see some superficial veins. The book says that this is normal. And next, let me auscultate bowel sounds. Great. All his bowel sounds sound great. Next, I'm going to go ahead and palpate. There's no rigidity. There's no tenderness. There's no masses. I can go ahead and roll him over. I'm going to assess his back. His spine is midline. It's closed. It's straight. And I don't see any bulges in his spine. Next, I'm going to assess his extremities and his joints. I did notice this baby has 6 fingers and 6 toes. So that is my second abnormal finding. First being the clavicle, the second being the 6 fingers and 6 toes, which I think is really cute, actually. So next, I'm performing a Barlow maneuver, where I'm going to check his hips and his pelvis for any clicking that I hear, and I don't hear any clicking. None is heard, so that's great. And his neurological function seems normal. I can clap to see if he reacts. It kind of startles him. So I know he can hear and reacts to loud noises. Okay, next with my gloved hand, I'm going to stroke his cheek and check for rooting. He turns to me and he attempts to grab the finger, so I know his rooting reflex is intact. Next is the Moro reflex, which I did earlier. I clapped my hands. It kind of startled him, and that was normal. So the third reflex I'm going to assess is the Gallant reflex, and I can place my glove finger in his mouth. He has a great strong sucking reflex, and that reflex is intact. Okay. Next, I'm checking for a tonic neck, and I don't see it. His neck appears fine. No signs of tonic neck. And I can put my little pinky in his hand, see if he's got a palmar grasp reflex, which he does. He hangs on to it for a little bit, so he's got a palmar grasp. And at this age, I would not anticipate having a good stepping reflex, which I don't see. He doesn't have a step reflex. So finally, we can do the Babinski. I'm going to go ahead here and check his feet. He's got a positive, his Babinski reflex is normal. Finally, I'm going to check his genitals. I'm going to pull back his forehead. He's not yet circumcised, obviously he's a couple hours old. I'm going to check the foreskin. I'm going to check the placement of his urethral meatus. His testicles appear normal. There's no masses or edema. And I'm inspecting his rectum and anus, and that all appears normal. So this concludes my video assessment of the newborn patient. Thank you.